Nowadays, sexual dysfunction disorders are more common, but no one is considered and taking care of it. Myself Sukumiii, I am the student of occupational therapy. Sexual dysfunction can affect any age group, but it most commonly after 40 years, over 40 years, because they have health decline during this age, they have many health declines like diabetes as well as hypertension like that. They have many health decline. It leads to the sexual dysfunctions. Many people having sexual dysfunction before 40 years also. What are all the disorders among female? First, sexual arousal disorder. These females having very low interest than normal, then it is called sexual arousal disorder. Second, sexual aversion disorder. In this, the female avoid all the sexual activity. So, and this avoidance character persistently having. So, she continuously having extreme aversion to the sex. Then it is called a sexual aversion disorder. Orgasmic disorder. In these, females don't get orgasm at all. So, or else it may take time. It may delayed, not happen. So, that is called orgasmic disorder. Then pain. During intercourse, the females may feel pain. So, it has two types. Dyspareunia. So, in this, the female feels pain in the hip region, pelvic region after intercourse. Vaginismus. The muscles of the vagina feels tight and contracted to the female. So it causes pain to the person. Okay, now what are the disorders among males? First, erection disorder. The person has inability to erect or maintain the erection to have intercourse. That is called erection disorder. Hypoactive sexual desire disorder. In this, the person have low interest. So it is not for a particular time. The person have continuously having low interest at all. So they have reduced interest or then premature ejaculation. It is a rapid ejaculation, fast ejaculation, too early in the intercourse. So the ejaculation may occur before intercourse also. Delayed ejaculation. It is direct opposite to the premature ejaculation. In this, the person takes more time to ejaculate and can't ejaculate at all. They may have chances to ejaculate delayed or not ejaculated at all. Then pain, dyspareunia. So they have genital pain during intercourse and during sexual activity. What are all the causes for these disorders? First, atherosclerosis, blood vessel disorder. So the person having more lipids in their blood vessels, it may lead to these disorders. And previous stroke or nerve damage to the person leads to these dysfunctions. Hypertension medicine and antidepressant depressive medicines also leads to these disorders, and the person have naturally have low libido can also lead to these disorders, or else alcoholic abuse, drug abuse, any abuse can lead to these disorders. And also past sexual trauma, anxiety, stress, depression, and relationship problems also leads to these dysfunctions. How the sexual dysfunction is treated? If the cause is the medicine, then we have to change the medicine. If they are having antidepressants, so they have psychotic problem and they taking the antidepressants, then we have to change the antidepressants. So if they have these problems, if they have hormone deficiency, then we can give drugs to stimulate the sexual activity. For men, Viagra. Its original drug name sildenafil, tadalafil, vardenafil. These like hormone drugs. So what these drugs are doing, it increases the blood flow to the penis and increases the sexual activity. For erectile dysfunction, the persons may use vacuum devices, penile implants. It also improves the erection. So the person may get out of this erection problem. For women, they may have a contracted vagina or narrowed vagina. They may have used dilators. So these are the mechanical aids for these disorders. Psychotherapy. If the person has past trauma in their sexual activity, then we have to give psychotherapy. Due to the trauma, the person may feel anxiety, fear, guilt, and they imagine themselves as a very small person that like. So they have many psychological problems. We have to talk with him and we have to solve their imaginary myths and come to take the person to the reality and make the person live happily. How can we prevent this? by education and communication. We have to educate our child, unknown person, about their anxiety, their imaginary fears. So we have to take back and we have to overcome many barriers to have a good, healthy sexual life. I know this video is very useful for you. I want your support. I also want some motivation, right? So please subscribe to our channel. Thanks for watching.